Well, booster shots, they are coming back the week of September the 20th.
The recommendation will be that anyone who got the Pfizer or Moderna vaccine should get a booster shot 8 months after their second shot, with healthcare workers, nursing home residents, and seniors first in line. ABC 10 News reporter Rina Nakano explains the eligibility and the timeline for the rollout.
Wednesday, the Biden administration giving the go-ahead to Americans 18 and over who got the Pfizer or Moderna COVID-19 vaccines to get a third shot 8 months after receiving their second one.
We'll be ready to start this booster program during the week of September 20.
This comes hours after Surgeon General Vivek Murthy announced the plans for the rollout in a live stream.
The plan ensures that people who were fully vaccinated earliest in the vaccination rollout will be eligible for a booster first. This includes our most vulnerable populations, like our healthcare providers, nursing home residents, and other seniors.
According to the CDC, vaccines have different immunity lifespans. For example, the yellow fever vaccine can last a lifetime. Tdap needs a booster every 10 years, the flu every season. Early studies are showing that Pfizer and Moderna COVID-19 vaccines should be given a boost after 8 months. The Surgeon General added that boosters are also likely in the future for the former one-and-done Johnson & Johnson vaccines. Because the first J&J shots were given in March, months after Pfizer and Moderna, they're still studying its effects.
With those data in hand, we will keep the public informed with a timely plan for J&J booster shots.
Some have criticized the U.S. for allowing boosters while other countries struggle to give first shots. But Biden says the country is doing its part in taking care of the world.
During the coming months of fall and early winter, we expect to give out about 100,000 boosters, and the United States will donate more than 200 million additional doses to other countries.
Rina Nakano, ABC 10 News.
The administration says that the booster shots will be free for Americans. They will be available at 80,000 vaccination locations nationwide.
All right, joining us now to talk more about the booster is Dr. Robert Schooley with UC San Diego School of Medicine. Thank you for being here with us, first of all, Doctor.
You're welcome. How are you?
I'm good. We have seen the data. The vaccines are working. So why are these booster shots so important right now?
We're beginning to see some of the people who got vaccinated first having more of these so-called breakthrough infections. They generally don't cause severe disease, but they are contributing to the ongoing churn of the virus infection in the population. They're spreading some to other people, and some of the people are getting sick. Now, remember, the people who got vaccinated first were the ones who are most likely to get sick with COVID to begin with. And it's not surprising that because they've been vaccinated the longest and are already at greater risk, that a few of these cases are severe, and we're trying to get around in front of those and prevent any more of those and to nail down the immunity of the general population.
You talk about these breakthrough infections. We do have some people who have been fully vaccinated, very few of which are hospitalized. Some do have symptoms. Most of them are mild, if so. So how much protection can these booster shots provide?
They actually may tighten up things a fair amount. We'll have to see. The first 2 shots were given closer together than we would normally give vaccines, and that was done to get the immunity in the population up as fast as we can. Now we have a period in which the immune system's had a chance to rest, to mature a bit more, and I think that this third vaccination may well take the immune levels to really substantially higher levels than they are now and provide both better protection against breakthroughs, hopefully better protection for the people who are at greater risk, and perhaps give us a much longer period of time between now and the next time we need a booster, depending on how the virus evolves.
So there's been so much controversy about the vaccine and masks. We're now seeing what's happening with LA County now requiring masks for everyone, regardless of their vaccination status. At major outdoor events, this is now going to happen. What are your thoughts and your recommendations for people here in San Diego County when it comes to masks?
Well, when out and about, I do wear a mask when I'm out and about among people. I wouldn't wear a mask walking my dog or out in places as some of the places you're showing. But if I'm in a grocery store or at a concert or at a backyard party with other people, when I'm not eating, I'll throw a mask on. It's not hard to do, and anything we can do to tamp down the secondary infections is going to give the virus less opportunity to to evolve. I do think these mask mandates make sense while the community infection level is as high as it is, and I certainly think it's important to do in schools.
You talk about the evolution of this virus and people not getting vaccinated, and it continues to mutate. You say herd immunity is not a possibility for years. Why?
Well, this virus is one that, like other RNA viruses, that includes HIV and hepatitis C, as a strategy to stay in the human population evolves every time it copies itself. It makes mistakes. Some of these mistakes lead to a virus that's a dead end, but many of them lead to a virus that's just a little bit better at growing in people than the one before. So every time we give it another shot on goal, we give it another chance to become a bit more infectious, a bit less susceptible to the vaccines, and to evolve so that we keep having to chase it with new vaccines. So we really are kind of giving the virus ourselves as a playground to make new variants that we're going to be chasing for years to come. And that's why I think it's really important to jump on this, shut it down with getting as many people in the population vaccinated the first time as possible. And then now that we have some leaky breakthroughs, although they aren't causing a lot of disease, if we can slow that down too, that'll be even less evolutionary space the virus will have. The less it has, the happier I'm going to be.
Yeah, I know a lot of people would like that. All right, Dr. Robert Schooley, thank you for your time and your insight.
Thank you. Have a good night. Bye-bye.